Yes, you're live now.
We're live.
Great, right. Good afternoon, ladies and gentlemen, and namaskar to everybody. My name is Manish Tripathi. I'm the Vice Chairperson of Singapore Indian Chamber of Commerce. Today with me, there is a very elite panel, which I would love to introduce first. Let me start with introducing Ms. Dr. Raj Kumar Khatri. We are very grateful, Dr. Raj Kumar Khatri, for joining us. He is the IAS, Senior IAS Officer and Additional Chief Secretary, Commerce and Industry from the state of Karnataka. I think Dr. Devi Shetty would be joining us in a minute, but I wish to introduce him as well. When he comes in, we will do it again. We extend a warm welcome to Dr. Devi Shetty, Chairman of Narayana Health, Bangalore, and head of the expert group COVID Technical Advisory Committee in Karnataka. We also have Mr. Ullas Kamath, Chairman of FICCI FICCI Karnataka, State Council and Joint Managing Director, Jyoti Labs Limited. Welcome, sir. I also warmly welcome Mr. Uday Davda, Head of Apollo Hospitals in Bangalore. Udayji, welcome. And last but not the least, Mr. Naganan Doraiswamy, Managing Partner and Founder, Idea Spring Capital and past President, TIE Bangalore. Welcome, sir.
Thank you.
So with this, maybe quickly put a little bit of color on why Singapore Indian Chamber of Commerce and Industry is doing a series of Zoom webinars, specifically on how governments, state governments in India specifically, and other governments are fighting this COVID pandemic and how we winning the war. We had the first webinar, Zoom webinar with the state of Tamil Nadu, and we had the privilege of having the Honorable Finance Minister with us from Tamil Nadu state government. We had a very elite panel that day where the Joint High Commissioner of India for Singapore also joined us, and both the countries shared the platform to exchange ideas how we defeat this COVID-19 endemic now, which is no longer a pandemic, where we have to learn to live with it, on all the three fronts: business to business, people to people, and government to government. So that's the theme of this webinar. I should not say much about Karnataka because the panel itself is completely aware of what they are, but for the benefit of our members and other participants who have joined us, Karnataka was the first state. By the way, it's amongst the top 5 states in India, and it was the first state in the country to think of a lockdown, which was very strictly adhered to. We have a very large expat community in Singapore from Karnataka, and we understand that the lockdown measures, the surveillance, the vigilance was very strictly followed, and all the guidelines given by the central government yielded very good results when the state went into a lockdown. And of course, we know there was a phase 2 and a phase 3. Phase 3 is supposedly coming. Phase 2 took all of us by surprise. But the first phase, Karnataka was the first to react. So now in this forum, we are all gathered here to understand what are the measures the business community, so maybe FICCI can throw light on that. When Dr. Devi Shetty comes, he's part of the task force. He can share with us what the task force is doing. And of course, from the government side, Dr. Raj Kumar Khatri, being a very senior IAS officer, a bureaucrat, could share with us. And similarly, we would try and see in the question answer sessions what we can share from Singapore, being a small city state, but Singapore has fought this war very well. And the data speaks for itself. We have done we just came out of a webinar from Honorable Minister, and every time the government is very alert to take measures and also to find out new ways and means to fight this endemic. So that's the theme, ladies and gentlemen, for this second webinar of the series. And without further ado, may I now request, I think Dr. Shetty is not there. If Mr. Ullas, may I request Dr. Raj Kumar Khatri to say the opening remarks and say a few words, or would you like to just set the stage for us and then we go to Dr. Raj Kumar Khatri? Mr. Ullas.
Thank you, Mr. Manish Tripathi, the Vice Chairman of SICCI, and also Johnson Paul from SICCI. It's a fantastic, initiative by Singapore Indian Chamber of Commerce and Industry, and this is the way how we learn what we are doing here and what you have done the best there, and exchange of the information is always good. And as far as Karnataka is concerned, as you rightly said the context, we were the first to declare the lockdown, and it was absolutely adhered in the best way possible in the COVID wave 1. And from the industry perspective, we were very, very clear that livelihood is as important as life also, because in India, you know that there are a lot of migrant workers going from state to state, and there are a lot of workers depends on daily wages. So while government was doing its job in taking care of the lives, and we from industry, we could do whatever the best possible to save the livelihood of the people, and which went very good in the phase 1 and phase 2 also in the COVID. And as far as the FICCI is concerned, being the industry voice to the government, our job is to talk to the industries on a daily basis, which we used to do every day in the evening from 6 p.m. to 7 p.m. every day. We used to have a call with the industry, and whatever the queries they have or the concerns they have during the lockdown period, we used to take that to the government the very next day. And Rajkumar Khatri is the person for us for everything. And you'll be surprised. Most of our requirements were got the clearances within 24 hours. So we always used to say that, okay, you give your requirement before midnight, and before the next midnight, you will have the clearance from the government. And most of it was happening from Rajkumar Khatri and Industries, Commissioner of Industries office for the clearances for the industry. And we also took like a lot of initiatives of vaccination drive, which definitely Uday Davda sir will talk about it, that what we did, because end of the day, what is required is the health of the people. End of the day, we want the health of the industries also. And today we have Naganandara Swami. He is one of the pioneer in venture capitalist, and he will explain to you that despite this pandemic, we got a few more unicorns out of Bangalore, and the fund flow which is coming into the state is one of the unprecedented inflow of money into the startup sector also. So while all of us were worrying and struggling and trying to do the best what is possible to take care of the health and the life and the livelihood, but parallelly the economy was doing extremely well, and especially the new age economy, and that's very, very heartening to note. And we have seen all the new recruitees coming out of the college, where the interviews were happening through the virtual thing, and their job also they got in virtual, and they are starting their work virtual. So in reality, the people who have got into the last batch of big companies, they've never seen the building ever in their life. From coming out of the college, getting into virtual interviews and getting the offer and signing the offers and sending the offer letters in a scanned way, and just got into the job and doing the job. This is unprecedented. Never ever we thought that such things could happen. Children are going to the school without going to the school. They're learning. They're writing the exam without going to the school, and they're graduating from one section, one class to other class. That also we are seeing for the first time. And state of Karnataka is as good as any other European country. It's a country by itself. So to that extent, government has managed exceedingly well. No doubts in my mind. And yes, being the state capital, it is not only we need to manage our population in Bangalore city, which is about 10-12 million, but also we need to cater to the needs of the district headquarters, because this is a destination hospital. People who are coming from the neighboring district, they just take the ambulances and they come to Bangalore city. And to that extent, definitely Uday Davda will be able to tell you that how they manage oxygen, how they manage the beds, how they manage the ventilator, how they manage the ICUs. It's just a nightmare, especially in the COVID wave 2. It was nightmare, and I think nothing like hearing from Uday Davda, who has been through that, and probably would not have gone home during those 30-40 days of time, which it was a nightmare here. But overall, we are back to business in more or less a normal way, and new reality to live with the COVID we have understood. And Dr. Devi Shetty, one of the finest doctor, he might be joining anytime now, but talking to him is a pride. Talking about him is a pride in India. He's one of the best heart surgeon with a very, very large heart, and very vocal in whatever he says. He doesn't mix the word, and he is a data person. He is a number person. He used to tell us, he used to tell everybody in the country that wave 3 we should be preparing along with the wave 2, COVID wave 2, and that's what he's been now taken as the head of the expert group, primarily looking into COVID wave 3. And he is saying that COVID 3 could be more or less like COVID wave 2, but we should be extra careful because he is the person who said that it might affect the younger generation rather than what we saw in the older generation in the COVID wave 1 and 2. He is the best person to talk about it. But overall, we are comfortable running the industry, comfortable in the way how the government is coordinating with us, and we are willing to listen to rest of the speakers. And if there's any questions from the industry perspective, more than happy to answer those questions. And if Dr. Rajkumar Khatri is there around, we request him to start talking from the government perspective, sir.
Dr. Rajkumar Khatri, I think you're on mute, sir.
Yeah, if not, we can go ahead with Uday Davda and he will join, sir, because the original time given to him was at 2:25.
I see. Okay. Mr. Uday Davda, head of Apollo Hospital in Bangalore. Udayji, all yours.
Good afternoon, gentlemen, on this beautiful day here in Bangalore. Very nice day, and very nicely summed up by Mr. Ullas Kamath as far as what has happened in the first wave, the second wave, how the industry really managed to go back and bounce back to the normal working. Well, the topic for me was to be talking about the way that vaccination has happened in the state of Karnataka. And I would love to take you through a small, very small presentation for about 3 to 5 minutes, and then we are open up for any question answer sessions that we might have. I'll take the benefit of being the first speaker and take this forward from here. Well, while we talk about the vaccination drive in Karnataka as a state, overall the country has done very well, but Karnataka as a state has done extremely well as far as the vaccination drive is concerned. I hope my presentation is seen. Am I?
No.
We are not able to see.
Okay, just give me a minute. I'll share the. Am I there now?
Perfect.
Yeah, so we will speak more about Karnataka as a state and what the state has done, what the private sectors have done, and what the government has done to bounce back to what we are today. And as we speak, I think the state is back to normalcy, except for a couple of hours of restrictions that we have and the weekend restrictions that we have. But otherwise, we see the normal life back into Bangalore, and not Bangalore, overall the state of Karnataka, and the industry being back to normal working as such. Well, when we talk about the private-public partnership that we have had in the state of Karnataka, there are about 3,342 sites which are vaccinating the people at large, being government sites, which are the larger in numbers because they reach out to the urban population as well as the rural population. They reach out to every area, small areas. At the same time, the private enterprises have done enough and more, and they've also gone out and reached a lot of spots. So there you see the difference that is made. The total vaccination that have been administered is about 21 million doses so far, which includes about 18 million doses in the first dose and about 35 lakh doses for the second slots. There are about 2 vaccinations that are very popular in India. One is the Covishield, which is the most popular, and Covaxin. So they've done close to about 19.21 million doses of Covishield, and at the same time about 2.5 million of the Covaxin in Karnataka region. And this is specific to Karnataka, all the figures that I'm giving you. Sputnik is yet to arrive, it is expected shortly. If we see, there is absolutely, the ratio that we see in the beneficiaries, almost 50-50%, both male and female. So there's no gender bias that we see here, which is a good sign. Everybody is coming out and taking the vaccination. When we talk about the age group of the beneficiary, we have the government initially opened up the drive for 60 years and above for the elder population, the senior citizen of the Karnataka region, which was received well in the initial stage. And soon after that, they opened it for people between 45 and 60 years, which was also received well. And recently, they've also opened up the drive between 18 and 44. So we've seen an equitable distribution across board in all three age groups, and they've accepted the drive very well. And especially after the second wave, I think the vaccination drive took a little bounce back, and a lot of people after the second drive started coming into the hospitals or into the public PHCs where the vaccinations were being given. When we talk about vaccination, it is available for everybody, be it mentally challenged, physically challenged, everybody. I would like to mention this especially here, saying that FICCI partnered with Apollo Hospital in the reaching out to the industry, which was very important. FICCI, right in their initial days, reached out to Apollo Hospital, or rather, we also partnered with them, and we reached out to all the industry members of Karnataka, and most of the industries are today vaccinated by, be it the private partners or the, government. So we see various areas where we've done it for all the corporates, we've done it for housing societies. There are various models that the government really pushed us to do. It was going out to the housing societies where we have multiple, apartments, and we would drive the vaccination at their doorstep. Be it the corporates, or be it the corporate offices or manufacturing industries, where we went and did for all their employees at the work site. So we were calling them as the COVID work site vaccination. I have a very small video which will talk about the expertise that we've had in protecting India and Karnataka.
Udayji, at least I cannot hear any sound.
Check the audio is not there, Uday.
So while we are talking about what we've already done as a part of our responsibility towards the society, I think we have another project which is coming up, and we are taking the India's largest private vaccination drive tomorrow. So this is about the vaccination that has been happening across the state and across the India. Thank you very much for allowing me this time, and I'm open to take any questions that might be there, or maybe we could postpone it a little whenever you want to take the questions. Thank you so much.
Thank you. The Q&A we will take after the panelists. That's the way it's planned. But your presentation was very, very informative. Thank you. But the audio for the clip, we couldn't hear. Some of the members or who they also messaged to me. But at least we could see the visual. We could see the visual. Thank you very much for that. So I don't have information if Dr. Devi Shetty or Dr. Rajkumar has joined us. If Dr. Rajkumar Khatri is there, may I request you, sir, to kindly address the audience?
No, he will be joining in a minute, but Nagananda will go ahead with now because his officer just texted me. He's just climbing the stairs.
Okay, then we'll go to Mr. Nagananda Doraiswamy. All yours, please.
Yeah, hi, thanks. And thanks, Mr. Ullas Kamath, for the giving.
Sir, Dr. Rajkumar Khatri has joined. So Naganand sir, is that okay? We hear him and we'll talk. Yeah. Anyway, you are our own person, like Dr. Rajkumar Khatri. Sir, Dr. Khatri has just joined.
Yes, okay.
Tripathi sir. Yeah.
Dr. Khatri, a very good afternoon from Singapore. My name is Manish Tripathi. I'm the Vice Chairperson of Singapore Indian Chamber of Commerce. All the audience and the elite panel is very eager to listen to you, sir. What steps the government has done to do a stellar job in Karnataka? Kindly let us know so we can share with Singapore also.
Good afternoon and namaskar to everyone. Friends, it's my pleasure and honor to be part of this webinar, which is organized by FICCI Karnataka State Council in association with Singapore India Chamber of Commerce and Industry. My greetings to all present at the event today. We all are aware that the economy is recovering from the impact of the second wave of COVID. And it is a very challenging time. In a survey that was conducted by the Economic Times, almost 60 CEOs of industries cutting across the sectors had suggested that government must take proactive steps so that the recovery for the industries could be less painful. Yesterday, Honorable Finance Minister, Government of India, has announced some aspects on the loan guarantee as well as coverage of risk by insurance. However, at the provincial level in Karnataka, I'm happy to submit to all of you that an extremely dynamic leadership of Honorable Chief Minister Yediyurappa ji and equally energetic, very considerate and very mature, tall political leader who is the Minister of Industries, Shri Jagdish Shettar ji. We were in continuous touch with the industry associations, and especially I would like to mention that Mr. Ullas Kamath ji has been such a strong bond in conveying the feelings and the pain points of industry, and as a result we were able to keep the essential industries operational, as well as specifically for MSME, concessions on the fixed electricity charges were extended by the two stalwarts about whom I mentioned to you. As on date, if you see, Karnataka has retained its third place in the country for FDI's inflows and has attracted 42% of the investment that came into India in the last 1 year. During this period, extensive interactions through digital mode with the industry partners, particularly in FMCG, aerospace, defense, and electronic mobility sector, has helped us to revise our policies towards making these sectors more attractive to the investors. Not only the facilitation, but relaxation of labor laws, particularly fixed term, it has proved quite handy and useful. And we are aware that from historic past, the legacy has been that a large number of compliances are supposed to be fulfilled by the industry. The focus has been always to increase the ease of doing business and reduce the compliances. And as a result, I would like to share with you that with the help of Government of India, we have identified almost 800 compliance points which we need to address, out of which 111 have already been taken care by making those compliances either online or removing it totally. And the next step is that we have identified more than 300 acts and regulations where I think we can merge some of the compliances, we can remove some of the provisions, and we can decriminalize some of the provisions. There are penalties which I don't think in a scenario, in an economic scenario like today, are relevant. And therefore, it is appropriate that these provisions of the acts and rules are done away as early as possible. And we, as a full team, are working towards this goal. Friends, I'm also aware and very happy that the industry associations collaboration, it has been one of the factors in bringing the industry and the government together. And my personal feeling has always been that the officers working in industry department are supposed to work as facilitators, because it is the captains of the industries who take the risk. They create jobs, they propel the economy. So justifiably, we must work towards removing the hurdles that they face, rather than creating more and more hurdles by increasing the compliance burdens. In the last few months, we have very successfully been working with multiple Singapore-based companies such as Capital Land, SATS, Vance Chemistry, Sarbana Zurong Group, and I would like to mention about the Ascendas India Trust, because more than a decade I have been associated in the capacity of a commissioner industries also. They have done extremely good job of developing International Tech Park in Bangalore. I look forward to Karnataka and Singapore's multiple industrial collaborations, and I would like to see that this collaboration further progresses and reaches new heights. In this, I have a very specific request to make to FICCI as well as to the SICCI, that the ties that you forge amongst the two groups of industries and industrial captains of industries, that has a very, very significant value in developing the new investment opportunities, in forging new kind of projects, and also bringing prosperity to both the groups. So with this, I once again request you for making me part of your discussion and webinar today. And I look forward to continue working with you and looking forward to be of any help that the captains of industries from Singapore, Karnataka, they require. Thank you very much.
Thank you, Dr. Khatri. Very inspiring message, sir. Actually, pandemic is creating havoc, as we all know, but your speech was like an oasis in a desert, because you said what you kind of reinforced, Dr. Khatri, is that the cure should not be worse than the disease. So as we fight the pandemic, Karnataka has kept the businesses alive. FICCI has worked very closely with you and your industry and your department. We also heard, Dr. Khatri, some unicorns have come up in the last 1 year from Ulasji. So, you know, this information inspires us in SICCI and our members who are listening, that we will fight this and we will learn from all parts of the world how to fight the disease on one hand, but keep the businesses, the jobs alive. And I'm going to repeat one of your statements, that the captains of the industry also have a duty. So we will do a small part. So we'll continue to do a small part. So thank you very much for that. And before we go to the question answers, may we request, sorry for giving you an interruption, Mr. Nagaran Doraiswamy, Managing Partner and Founder, Idea Springs Capital, and past President of TIE. All yours, sir.
Thanks, and thanks a lot for having me here. I would like to start off by thanking Dr. Rajkumar Khatri for the immense work the state has done. I think I'm a proud citizen of Bangalore and Karnataka, and I can shamelessly say that Karnataka is one of the most advanced states when it comes to governance in supporting the industry in various aspects. Like, we were the first one to do the IT policy, first one to do the ET policy. And there has been a great relationship between the industry and the government, and thanks, sir, for continuing that. And we have immense confidence in what the governance in the state is doing. And that's one of the key reasons why I think Bangalore is still the #1 sought after destination when it comes to technology, when it comes to manufacturing, when it comes to healthcare. And you know, with your support and confidence in the industry, we'll continue to maintain that leadership position going forward as well. Thanks again. And continuing that, so I was asked to talk about the startups and the industry, startups in specific in this webinar, and I'll focus my talk on the startups. So Bangalore accounts for about 37 to 40% of the entire startup ecosystem of India, right? So we are kind of in the forefront of anything that happens in the startup industry in India. And we have taken this leadership position and we have sustained it over a period of time. So we own about 40% of the market when it comes to startups. And if you look at what has happened, obviously there was a lot of livelihoods affected because of wave 1 and also because of wave 2. But if there is any blessing in disguise, or if you want to search for the brightness in this whole dark situation, I think it has enabled immense acceleration in digital transformation, because of inaccessibility for any physical infrastructure, whether it's a hospitality industry, people going to restaurants, people going to movie halls and so on and so forth, or people going to stores to buy something, I think those industries were affected very badly. But because those were inaccessible, what that enabled is for the digital infrastructure to really, really leapfrog from where it was to where we are today. Even if you look at a delta of 1 year, there has been a significant change. And because in Karnataka and in Bangalore, we are ahead in technology and tech-enabled businesses, we have seen a significant growth and positivity in the startup ecosystem, and also in the overall feeling of comfortness for the startup industry to go forward in Bangalore and Karnataka. Of course, in Karnataka, most of the startup ecosystem is driven in Bangalore, so I'll just say Bangalore rather than saying Karnataka. But to give you some numbers as to what has happened in India in terms of both funding and in terms of startups. Whole of last year, because of COVID, we raised about close to $10 billion in India. So I assume about $4 billion came to Bangalore. But if you look at what has happened in the first 5 months of 2021, we already have raised $9 billion. So $9 billion has gone into startup investments in the just 5 months of this year. So obviously, compared to last year, there's been a significant move, significant advantage in the startup industry thriving in the current environment. And I was talking to a friend of mine very recently who heads is a chief operating officer on the large food delivery companies in India. And he said during wave one, it took them like 4 months to convert 75% of the regular customers to get comfortable to buying. But when the wave two happened, they didn't have to move any needle because people are already comfortable in their ability to order anything online. So the startup industry per se, hence was already gotten the benefit, if I can use that term very loosely, of wave one, where people had gotten comfortable with digital technology, people had gotten comfortable in ordering online, people had gotten comfortable in studying online. So the impact from wave one to wave two was hence dampened because of the wave one getting all of us to think how to work virtually, getting all of us to think how to work digitally. And that has hence, in fact, increased the awareness of startups in Bangalore. And as you can see, there have been 16 unicorns that have been created already in this year, in the first 5 months, out of which 7 or 8 are from Bangalore. And the investments are quite high because of 2 reasons. One is the market in India itself has opened up significantly. And number 2, because of the ability that the startups have shown to sell globally, right? The one advantage we have with startups, emanating out of Bangalore, because we are very technology focused, and we also sell to B2B significantly, is the fact that the market is just not restricted to India, but every product our startups develop, the market is global, right? So hence the amount of capital raised just to invest in Indian startups, the VC funds that were raised, money that was raised by VC funds was 6 billion to just invest in India. So you can see the kind of energy that is there. You can see the kind of activity that is there to invest in startups in India, because we are showing tremendous promise, not only in India, but also across the world. And the reason why people are getting very excited about India is because of the fact that there's a Bharat market now, right? If you look at the number of UPI transactions, it is 2 billion plus UPI transaction. And we are beating everybody hollow in terms of the number of transactions that is happening. And there's a study that shows that anybody who wants to roll out anything digital, they always try it first in Bangalore. The reason they do it is because they believe the Bangalore citizens are the most digitally savvy and the most accommodating and the most innovative, even when it comes to trying out new technologies, right? So I think hence all these things, whenever anybody wants to try anything out, Bangalore is the first place they're going to try out, because of all these factors, and add to it the cosmopolitan nature of the city. So I think we have significant benefit, significant advantages for startups to thrive in the city. And the fact that the lot of industries have opened up, industries such as healthcare, industries such as entertainment, industries such as education. I think there is abundant opportunities for startups to not only thrive in Bangalore/India, but abundant opportunity to thrive across the world. And in addition to that, being backed by a lot of good research places and a lot of good tech parks and also incubation centers that have started. For example, if you look at life sciences, what's happening in India, life sciences, we have 2 of the most premier life sciences incubation centers in Bangalore. One is called Bangalore Bio Center, which is jointly sponsored by Government of India and Government of Karnataka and BIRAC. And the second one is CCAMP, Center for Cellular and Molecular Platforms, which again is an initiative by Government of Karnataka. And the kind of startups that are there working on various life sciences and health tech initiatives is phenomenal. And I would greatly appreciate if any of you visiting Bangalore, you should go and see these places to see the kind of work that is happening. And hence, coming from the VC world and being a venture capitalist, I'm extremely positive and extremely excited to be part of this. At this time, I think we're in the golden era of startups. Of course, last year was very, very hard. COVID-1 was very hard. And the month of COVID-2 was very, very painful because of the intensity with which the virus was hitting the citizens of Bangalore. But I think we have seen the worst behind us, and I think it's time to grow. It's time to be positive. The government, along with the hospitals like Apollo, is already preparing for the worst, if it were to happen. And I'm sure even if there were to be a third wave, God forbid, we'll be well prepared to manage it. But overall, I think very exciting times looking ahead, a lot of activities, and looking for greater partnership between Singapore and Bangalore. I know there's a lot of startups that from Bangalore work with Singapore and vice versa, and really looking forward to greater collaboration between Singapore and Bangalore, and looking for better and exciting times going forward. Thank you.
Excellent, Mr. Nagaranduraswamy. Again, a very inspiring business and startup talk for us. Singapore, as you know, is a knowledge economy, and the startup and incubation. We have a subcommittee within the chamber which nurses and grows startups here, and I'm sure people who are listening will be very excited to hear about the positivity. So, Mr. Ullas, I think Dr. Devi Shetty may still be busy with his operation of the patient. With the permission of the panel, maybe we straight away go to the questions, which we have received a few of them. Shall we go to the Q&A straight away? Great.
Yeah, absolutely, we can do it. And just for information for the viewers, that Dr. Devi Shetty's officer just texted me that he should be there any moment. But as soon as he comes, he'll give his address. But we go ahead with the question and answers. And as that Dr. Rajkumar Khatri also has a meeting at 3, whatever related to the government related questions, we can post it to him. And for me, from the industry and from the hospital, Devda is there, and anything with the startups, and Nagarand will always be there to help us to answer the questions. So over to you, Manish Tripathi. You can ask whatever the question you want.
I have 3 for the time being. The first question, of course, no surprises, goes to Dr. Rajkumar Khatri. Sir, if I'm audible, the question here is about the unstructured labor force in India. So there are some newspaper information that close to 50-60% of the daily wages, as we call in India, they lost their jobs as they moved. What is Karnataka doing to see that this unstructured labor force gets back their jobs and the livelihood back? You are on mute, sir.
Thanks, Manish. I should have dwelled more about it in my initial remarks. And I am personally also in a position to, kind of relate and appreciate it more, because I could spend about a year working as additional Chief Secretary of the Labor in the government of Karnataka. For the unorganized sector, particularly if you see, the broad category is the construction workers. And then you have, I'm going by the numbers, then you have a large number of them, those who are in the service sector. Now, many of them had come from other states to work in Bangalore or other parts of Karnataka. And we saw in the initial stage when the lockdown was clamped that many of the labor force, they moved to their villages. But somewhere around October of the last year, when Deepavali period and all, we saw a movement of people coming back to join the construction work. And during these lockdowns also, we had not closed the construction activity. In situ construction was permitted. Now, there are 2 ways where we are trying to promote that the labor stays here, stays healthy, and comes for work. One is the vaccination. Now, in fact, we had a detailed discussion and interaction with the construction sector as well as the other industrialists, that how quickly can we organize special camps for the vaccination of the industrial workers, including the unorganized board. This is one sector. Second is from the labor welfare boards and the construction welfare board, special packages have been given so that the laborers, they are able to sustain. And wherever we have found that there was a delay in payment or there was no payment, they have been facilitated to make the payments. So these are the three broad steps which we have taken.
Thank you very much, sir. Very clearly done. The next question is on, maybe I would go to Mr. Uday Davda, because, or anybody else, most welcome to answer. It's about the third wave. There are various forecasts, and you said Dr. Devi Shetty also had said there'll be a third wave, possibly going towards lesser age children or a different category. So the question here is, third wave, how real is it, and what has India or the world learned from the second wave lessons?
I think as far as the industry is concerned, the third wave is imminent, because we've seen the third and the fourth wave also coming in other parts of the world. So it does not really bar India as far as we are concerned that we will not have the third wave. It is going to be there. The only virility of this virus needs to be seen as we go forward. But the second wave has taught us enough. And as in your opening remarks, you said Karnataka has taken a lot of leap steps to ensure that the people are protected and the facilities are given. And I think with the learning of the second phase, also the government has also become very, very careful, where government is also having a private-public partnership. The private hospitals are asked to dedicate certain number of beds for the government patients or the government nominated cases. The government is equally prepared. Government has made enough and more rooms for the additional beds to be incorporated in the state of Karnataka. Apart from this, the private sector has also ramped up. In the second wave that we saw, we did see larger numbers, and we had to ramp up our capacities and have additional beds created, though it may be temporary, but we created additional beds. Yes, we are prepared for the third wave, which is likely to come. The industry also talks about this wave is going to be more virulent towards the smaller children. And with the help of Government of Karnataka, there are a couple of sessions which have already happened where the doctors were given on, I would say at Nimans in Bangalore. Nimans is a hospital in Bangalore. In the convention center, we had this. And hands-on training was given to the doctors to ensure that the children are protected in the second wave to come, in the third wave to come. So I think we are prepared. If it is imminent, then we might as well be prepared and ensure that we take it by horns. And I'm sure the industry is prepared. And with the support of the Government of Karnataka, I think we are able to make it happen.
Thank you.
Yeah. Just to add what Uday, sir, you are coming in, sir, Dr. Khatri, sir.
I just wanted to supplement what Uday said, that the oxygen production and supply was a critical issue that we faced in second wave, for which the storage capacities at all the district level and the smooth logistics have been already planned. In fact, our Honorable Industry Minister, Shri Jagdish Shetterji, had personally supervised that the oxygen is provided, and we are fully geared if we have to face the challenge of provision of oxygen. We are fully geared for that.
Yes. Just to add to what Dr. Khatri sir said, the first wave, I think it went by without affecting much, even though the fear was more and the numbers were not affecting us. Trust me, in the second wave, whatever the numbers we are seeing, we are able to put some of our own faces, some of our relatives, some of our friends, some of our well-wishers, some of our office employees, their people. So we were able to put certain faces to the numbers, what the government has said, that so many number of people have died. There is face to it in the second wave. I think that has made the change in thinking of everyone. And that will make us to sail through the wave 3 with much ease, because it is better to be overcautious rather than overconfident. I think after the first wave, we took life little easy, no doubts in our mind, and we started exporting the vaccine when there was no demand in India. And that is a reality. When there is no demand in India, the vaccines start getting exported, and based on the commitments what they had given. But today we can say that the way how the government has taken the position, I'm very, very proud, like how Naganand sir said, I'm very, very proud that the kind of cordial relationship what we have between the industry and the ministry, we are just phones call away. Like whether Dr. Khatri or in the industry minister or Jagdish Chatterjee, everybody are available for one reason, that we need to sail through with the least of the impact on the common man. And as far as the industry's preparedness is concerned, most of our employees are vaccinated once, or some of them will be twice also because of the age. So Bangalore city as such, you'll be surprised. It's happening from morning 8 o'clock to evening 8 o'clock. Every hospital, people are getting it done. And as we speak now, Federation of Karnataka Chamber of Commerce, which is a local body, is doing the free vaccination under the leadership of BBMP Commissioner for factory employees who can't afford the vaccination in a private hospital. It's free. And FKCC auditorium is filled with the people now to going for the vaccination. So when the government is there with us, in all respect, whether it's running of the company, opening of the factories, giving the transportation, and I'll be failing in my duty if I don't mention that Dr. Khatri sir was personally supervising the opening of the industry with whatever the needs they need, including transporting the employees from one place to another place. And he had given us, including the KSRTC buses, the local transport, to ferry the employees from factory to factory. And with his assistance, we were able to put up one big oxygen unit in Hubli, which is the initiative of MRPL. So that's also coming up. Probably third wave will not be as severe as wave 2, but just to quote Dr. Shetty, he was very, very vocal that we should not worry about the COVID wave 3 as long as mothers are vaccinated fully. And his only worry of COVID 3 was that while we can provide the doctors, we can provide the nursing, we can provide the beds, but we cannot provide mothers to take care of the young children. It is very, very difficult to manage the children in the hospital. So he was saying that ensure that every mother having smaller kids is 100% vaccinated so that they can be with the children to manage the children. So his worry was only on that. And absolutely, government is prepared. That's why we have made him as, the government has made him as the leader of the task force for the COVID-3 and as an expert. And I'm very, very confident from the industry perspective with the kind of partnership what we have and the relationship what we have with the government of Karnataka, we will come out with least of the scratches. Sir.
Thank you, Lasji. The next question is actually a residual question
Manish,
from us.
can I seek permission?
Yes, sir, absolutely. We were privileged to have you. Dr. Khatri, we were privileged to have you, sir. Thank you very much.
Thank you very much, sir.
We'll keep in touch. Thank you. So next question, any of the panelists can answer. It's a residual question from our last series. It's a very interesting one, and it couldn't be tabled last time. This is about the sports fraternity. So, I mean, the question is that there is so much focus on disorganized labor, students, children, jobs, unemployment, but there is a community who actually thrives on outdoor, and the sports, the gyms, the professional athletes, professional players, they must be going through a very tough time. I mean, we all know Olympics is coming and various steps are being taken so that the athlete or the professionals can be there. What has the government in India or Karnataka government done so to take care of the professional sports people whose only livelihood was outside and not inside. And I'm sure the question also says there are possible mental effects of sports people who are not able to go outside and compete. So anybody from the panel can answer.
Naganand is the best person because he is a sports person himself.
No, so I think that's a very interesting question, because anything that requires any physical, any outdoor activities, whether it is tourism, hospitality, sports, or any such thing, I think has been very, very poorly affected. Not only sports, even artists like who used to give a lot of concerts outside, and who that was their mode of earning their livelihood. I think a whole bunch of people have been very, very poorly affected. And I think what has been done is to support them through grants. I'm part of the Karnataka State Lawn Tennis Association committee as well. I'm the president, but there's really nothing you can do, because we couldn't conduct the tournaments, and we don't have the kind of grants that we could give. So wherever possible, in addition to the support from the government, we have raised money from the from people who want to support the artists, who want to support the sports persons, and then give them the necessary support that is there. Because the government has done what they could to support all these people, but when it comes to mental health, even people that, like you said, if they go to Australia, even the cricket team, when they have to stay indoors for 2 to 3 weeks and not talk to anybody, not do anything outside, it's almost impossible. It's a very, very painful scenario, which all of us have never prepared to, and I don't know how to handle it also. And in fact, in addition to the sports, when you look at professionals also, everybody loved work from home initially, right? Everybody says, I'm so happy working from home, but now 80% of the people I talk to say, I'm done working from home, I want to go to office. But it's percolating not only into sports and artists, but it's also percolating into professionals now. So I think it's a very hard problem, Manish. I don't know if there is an easy solution for that. The government has done the best it could in terms of supporting the grants, in giving grants to the sports people and support them. And there are a lot of mental health clinics and so on and so forth, but there's no easy solution to this. It's a very hard problem at hand.
I'm also a very keen sports person. I was vice president of Singapore Cricket Association. Both my boys played for the Singapore national team. I'm a marathon runner. So that's why this question resonated with me, because I see a lot of youngsters who were 19 years old, ready to play from Singapore for a World Cup under-19 qualifier, and now they find suddenly they are 20 years old, so they miss the chance. So, and they are going under a little bit of, I'll not say depression, Mr. Doraiswamy, but they think they've lost a chance. So so there are many such challenges. Mr. Ullas, should we wait for Dr. Devi Shetty, because I have one more question? Yeah.
No, I think we can go ahead. We don't have to wait.
Okay, we have one last question, and this again, anybody from the panel. So somebody is asking, when will COVID-19 end? Do we have to learn to live with it, or we see an end like all other pandemics before?
I think the question is not as easy to answer, because COVID is going to be there for some time at least to live with us. And the only precaution that we have to take care is the COVID behavior, the COVID appropriate behavior, I would call it as. And we don't see immediately anything coming an end to it. And maybe for another year or two is COVID going to be around, and we have to live with it, and we have to learn to live with it. That's what is the industry talking about, and as far as the healthcare is concerned.
I think everybody feels the same way. May I draw in Mr. Johnson, the CEO of SICCI? Johnson, you have any other question I missed out? You're on mute, or you want to say something to the panel?
You're on mute.
Sorry, yeah. No, I don't. I think it's a very interesting conversation. Very happy to have the feedback of people on the ground, the in situ ground up view. Thank you, VC Manish. Yes.
I know, but actually Johnson and his team, you can see Pooja and Gauri and Divyan is hidden behind the word SICCI. They did all the hard work to make this happen, and thank you all the members of SICCI who joined and the elite panel here. Johnson, you want to thank all of us very quickly? 5 seconds.
Yeah, okay. First and foremost, I must thank Mr. Hablika. I think he's a participant who has helped to coordinate this meeting. And of course, Mr. Ullas Kamath, who very graciously pulled together the team.
Yes.
Mr. Nagaland, Mr. Uday Deva, Mr. Kumar, who's I think left. And of course, this on the SICCI team, we have VC Manish, we have our other Vice President Kishore also online.
And Kishore Bhai. Welcome, Kishore Bhai. He's my co-vice chairman. So, yeah.
So, and we want to thank Navita as well from FICCI, who has been coordinating locally.
Thank you,
so thank you very much.
Yeah, thank you. And thank you. And before we close, I'll ensure that 10-minute clipping from Devi Shetty, he will speak to us, and I will get it recorded and send it to Manish sir. You can circulate to your members, because he's not a person who missed any of the meetings in the past when you have called him. Maybe really emergency, he is stuck in the OT. But however, I'll get that 10 minutes of his video recording on the program. He has prepared well, and I'm sure that he'll be able to talk to us and record it, and we'll send it to you so that you can circulate your members.
Ulasji, I'm sorry to interrupt you. I was really looking forward to Dr. Devi Shetty's interaction. I'll tell you why. I was saving this, but I have to say it to you. Kindly convey this to him. In 2019, I did a course in Harvard, and there was a case study on Dr. Devi Shetty, Narayana Hospital. The course was called in Entrepreneurship in Emerging Markets. And absolutely, I was floored by, you said he has got a big heart, right? I was floored by his modeling and what he does. So convey to him that Manish had done a course and saw your case study, and I was looking forward to saying hello to him.
No,
but,
we'll call him once again.
You
can always call him. He'll come. He is a wonderful person. And why I said there's a large heart. Like when I was going to, going to airport once, I found the delivery boy who was picking up the bag, and he's talking to me saying that, his son has a heart problem. I said, the person standing there, he's a heart surgeon. Go and talk to him. And he went to him, and he spoke to Dr. Devi Shetty. I was there along with him. And he just told him, saying that, come to my hospital day after tomorrow morning with your son. That's all what he said. This person who is from the airport, very next day, I told him where to go, how to go, sent him the car. He took that boy from his village to Dr. Devi Shetty's hospital, which has more than 3,000 beds. And they have 18 operation theaters to do the heart surgery. But Dr. Devi Shetty was waiting for this boy, and he did the surgery himself free of cost. That is why I call him as a Dr. Devi Shetty. And even today, when you see that boy who's in the airport, he says that, sir, on that day, you introduced me and all over the boarding gate itself. That is kind of hard if a heart surgeon has. It's amazing. So I will ensure that he'll speak to all of you. And second, whenever the next opportunity, please, I'll ensure that he'll be talking to all of you for sure, sir.
Thank you, sir. Thank you, everybody.
Thank you.
And namaskar.
Thanks. Thanks.